Hello, I'm LaTonya Turner. As you've just seen, there isn't a quick and easy solution to improving the health of Tennessee's children. This fourth episode in the NPT Report's Children's Health Crisis Series is part of a 3-year effort by Nashville Public Television to raise awareness and start a community-wide conversation on the issues affecting children's health in Tennessee. And to help us continue this conversation, we've invited 4 health experts into the studio. They are Kim Harrell, Director of Children's Health Improvement and Prevention with the Monroe Carell Jr. Children's Hospital at Vanderbilt. Dr. Amy Vehec, a pediatrician with Mercy Children's Clinic in Franklin, Tennessee. Dr. Michael D. Warren, Director of Title V, Maternal and Child Health at the Tennessee Department of Health. And Linda O'Neill, Executive Director of the Tennessee Commission on Children and Youth. What are some simple steps that the people watching at home, that any of us can take to do better with preventive medical care? Dr. Warren?
So I think first is an awareness of the value of prevention, and that's certainly why we in the health community preach prevention so much. We know that effort spent on prevention today is going to result in better outcomes in the long run. So for many folks, that first step is awareness. Then acting on that is an additional step, but awareness is absolutely key.
Awareness of steps that they can take by visiting their doctor more regularly. You talked about well child visits in the documentary.
Absolutely. Awareness of whatever preventive measure we're talking about. So it may be vaccines, getting immunizations to prevent against diseases that can be life-threatening or fatal. It may be preventive things like wearing a seatbelt or avoiding risky behaviors like smoking. Knowing what the consequences of those behaviors are or the benefits of prevention is a first step.
Okay. Is there anything else you want to add, Dr. Vehec?
I think it's tremendously important that folks give themselves permission to start where they are. And so if they can make a choice today to smoke a couple fewer cigarettes, or if they can make a choice today to walk a flight of stairs or to get one vaccine, that's a start. And then you don't have to do everything all at once. And doing what you can today, then you can do a little bit more tomorrow.
Do you think people have an awareness of some of these things and there's other obstacles or barriers that are keeping them from moving forward with them? Is there something you can address, maybe, Kim?
I think the awareness is indeed increasing. But I think it's what that means is the issue. Trust for America's Health did a survey recently that showed that 84% of parents think that their children are of healthy weight here in Tennessee, when we have 1/3 of those that children and adolescents who are obese or at risk for being obese. So there's a disconnect there. So while we are starting to talk the talk, I think we have significant opportunity to start walking the walk.
Can either of you address that from what you see in your practices?
I'm happy to address a little bit of that. I think with respect to smoking, a lot of folks are aware that smoking right around their child is not good for them, but they don't understand that there's still a risk to their child if they smoke in the other bedroom, or if they smoke in the car while the child's at school but not while the child's in the car. And so I think some of those things, there is not as much of an awareness, and so coming in and talking about those things can be really helpful.
Okay. And a lot of that we learned in the documentary can be done during the regular routine well child visits, as they're called, in the early stages of a child's life. And yet we learned there's such a big drop-off after age 2. How important are those visits to awareness and to overcoming some of these perception versus reality discrepancies? Dr. Warren?
Well, they're absolutely important. Every encounter that we have with a child and family is an opportunity to learn where are you with respect to various health behaviors. Where are you with respect to your environment supporting those healthy behaviors, and how can we connect you with resources that will help support those healthy behaviors? And we know that those risk factors don't end when you turn 2 or 3. They might change. And so, the visit with the 16-year-old is an opportunity to talk about wearing a seatbelt, safe driving, not texting while driving. Whereas with that 3-year-old, we're talking about a whole different set of things to look for. We're talking with the parent about the importance of reading to that child. We're talking about the importance of helping them avoid dangers in the home or dangers outside. But every one of those encounters is an opportunity to talk about something that's going to improve their health.
And so how do you get people to continue on that path after that age 2 or 3 drop-off with well-child visits. What is the key, do you think, to continue that process so that you're getting that interaction on a recurring basis with these families?
I think some of it has to do with the relationship that's established over time. And so hopefully in the first few years, we've been able to make a connection with the family so that when we say, we're looking forward to seeing you next time and here's when that next visit will be scheduled, they're going to buy into that. But also our office tries to make a point of calling folks. If we haven't seen them for their scheduled well visit, can we go ahead and get that scheduled?
Okay. And is that something that is practical to be done across the board? I mean, is our current medical care system set up to do that kind of work, to do preventive care?
You know, we often joke that you get a postcard from your car dealership saying it's time to change your oil, or a card from your vet saying it's time to bring your dog in for your rabies shot. So is it doable? Absolutely. It's not always been the norm from our current healthcare system to have that focus on prevention and to always be aggressive about reaching out to folks to say, hey, it's time to come in for your annual well-child visit. The other thing, though, that becomes very practical from a policy perspective is that visit a covered benefit? And so we may have families that very well know it's important to get that well-child checkup, but if their insurance doesn't cover a well-child visit for older children, then they may have to make a very real decision. Are we going to have food this month? Are we going to pay our rent? Or are we going to pay for the well-child visit? For our kids who are on Medicaid or TennCare, it's a covered benefit. And so we're very fortunate in Tennessee that we have TennCare to cover all the way up to age 21, and it covers those regular well-child visits. Many of the insurance companies on the commercial side are moving toward that because of some provisions in the Affordable Care Act, but that can be a very real barrier to some families.
Well, you've raised some issues around policy, and Ms. O'Neill, I'd love for you to comment on that just a little bit in terms of policy versus, I guess, personal responsibility. Where does policy fit into all of this?
I think we know we all want our children to be healthy and safe and to be educated and become productive citizens, and that starts when they're very young. And policy can make a tremendous difference. When we have good public policies, we do see improvements in outcomes for children. One of the examples is immunizations, where we rank at the top in the nation. And that's partly because of good health care and encouragement, and it's the right thing to do for our children, but it's also a part of public policy. If our children are going to go to daycare, if they're going to go to school, they have to be immunized. And so that's an encouragement for that to happen. Dr. Warren talked about seat belts. Our public policies require child safety seats for young children, booster seats, and then have mandatory seatbelt laws. Those are really important in improving safety for children. They're really critical prevention pieces that can reduce not only deaths but also accidents that cause tremendous lifelong problems.
Are there some areas that you need to tackle, or you think this state needs to tackle, that haven't been addressed through policy that could make a difference with this? Anyone?
Well, I think we've seen some policies put in place that really make a tremendous difference. Tennessee is leading the country really in having the coordinated school health programs in all our schools, and they have really helped improve health in schools. We've actually seen a small decrease in obesity. It's a very important decrease, so it's shown in a fairly short period of time that when we really are focused in a coordinated way on helping improve things like nutrition and physical activity and overall health and wellness, we can produce results. We've talked a lot about the medical care, but they're really environmental issues, as the piece talked about the importance of behavior and environment. And we can really do a lot of things in our communities to help improve prevention, help improve health outcomes if we have better opportunities for exercise, if we increase the amount of physical activity in schools, if our communities are safe. In too many areas, children don't feel safe going outside, or parents don't feel like their children are safe outside, so they're not going to be able to run around and play and get the kind of activity. In addition to prevention, we talk to parents about reading to their children and talking to their children. We need to help them really understand how important what they eat and what their children eat, what a difference that makes, and the importance of physical activity, just playing in a really healthy way instead of just watching TV or you know, or just reading, but really making it a game and making things fun.
I know that you're involved in trying to, Kim, trying to bring together some of these policy-related changes with existing resources. What are some of the things that are happening in a very practical way to implement some of these things?
And to that point, LaTonya, I think you'll hear that we do have the policies, and they are, relative to other states, very progressive. Yet resources are a significant challenge to having the various systems that are impacted by these particular policies really start to embrace what the visions they suggest. So community partners are key to this, and also and I think what would be helpful to a lot of the points that were brought up earlier as well is to fully integrate health in the various systems where particularly our children live, learn, and play, but also ourselves, parents doing the same and being a good mentor and role model. Specific to some of these projects would be the coordinated school health and how we're trying to engage community partners that have particular strength in certain areas that already have certain resources available as well, and bringing them together in an integrated fashion in the school to actually help promote good health. Also in the various neighborhoods, they're called food deserts, where individuals don't have access to nutritious food stuff that would be required for them to maintain a healthy lifestyle. Bringing community gardens into that, or farmers markets, or things of that nature. And we certainly have a number of projects that are not only promoted by Monroe Carell Jr. Children's Hospital, but also many of our community partners as well. So understanding the landscape, I guess, in summary, and making sure that we give credit to our various community partners for all the strengths that they can bring to the table.
I'm just wondering, do you find sometimes that in intentions to do good sometimes kind of miss the mark and do more harm? Exactly, often. And you can't criticize the motivation, but perhaps the method that they use could be improved upon. Okay. And is there an example you want to give us of that? Well, we became aware of one principal that was very concerned about their children. It was a relatively low-income school. Children leaving school and presumably not having a meal that evening. So she would give out candy as they would leave and get on the buses and the cars. So her motivation was very, very noble, but perhaps substituting that with a more nutritious item would have been the preferred way, or more importantly, putting them in touch with a community partner, such as the backpack program that's offered by Second Harvest Food Bank, would also even provide a more substantial meal for that child. What would it look like if everybody were working toward prevention, whether it's policy and practices, medical practices? What kinds of things are missing that you would foresee being in place to really get us to focus on preventive medical care? And I'm going to start with you, Dr. Vehec, because I think you all at Mercy are already kind of taking the lead in some ways with the medical home.
We do have in place a medical home, and we really try to use that to address the various needs of the children and their families in our practice. And we look at trying to follow best practice standards in terms of seeing our asthmatic patients on a regular basis to try to prevent asthma flare-ups rather than waiting till they happen to treat them, looking at optimizing care for families with mental illness, and looking at establishing that relationship with the family that allows little by little to work on the next thing that the family feels is important to work on. We really look to ask all of our families to choose a primary care provider for their child, and then of course there will be days that the child is sick and the provider's not in the office, but as much as we can, we try to have that child seen by that same provider every time, so there is that consistency and that continuity over time.
Okay. And yet we saw in the documentary Alana, who has access to all sorts of medical care for her sons with asthma and seems to be doing what is recommended, and yet there are some things that are still out of her control that are contributing to not so positive outcomes. What about someone like that parent? Anyone?
So I think we have to start broadening our concept of health, and we typically think about health care when we think about health, but we know that if you look at the determinants of a person's overall health, the actual health care they get really only accounts for about 10% of their overall health. It turns out that things like their genetic predispositions, social factors, health behaviors, the environment, actually play a large role in that person's overall health. So what we really want to do is broaden that. So we're thinking about what are all the touch points. Kim talked about the schools. Schools are a great place to integrate health. Turns out kids spend a lot of their hours of a given day in school. And so Alana's family may be getting great medical care, but if she's in a school where there's exposure to environmental triggers that might trigger her asthma, if she lives in a community where many of the people smoke and she walks home from school and walks through cigarette smoke, if she lives in a house that has mold or other triggers for her asthma, then the health care may be addressing some piece of it, but it can't address all the other pieces that contribute to her health.
So what about the things that she can't really control or she doesn't have the resources to do much about? How do we deal with those?
I think we can work on public policies that, and we have some good ones that really provide a foundation through coordinated school health, through things like family resources and other supports. But the more we can have them working together, and we also need to look at other things like safe communities and walkable communities and neighborhoods, parks, and places where children can play and really get the kind of physical activity they need. We also could use as an example that it's really going to take a while to change the environment around issues like obesity and nutrition and physical activity. We hope it doesn't take as long as it took from the 1964 Surgeon General's report on smoking to finally having smoke-free policies in Tennessee in 2006, but we need to keep working on that. And the more we can help people understand how important those community factors are that Dr. Warren talked about, the more we can really change the culture and the environment that really says, you know, it's in all our interests and in the interests of all our children that we have walkable, livable communities, that we have adequate food that's really healthy, that we have school lunches that really tap into the community gardens and the other opportunities for fresh fruits and vegetables, and we really focus on healthy eating and healthy activity levels.
What would be the next hurdle for that kind of policy?
Well, I think we're working on things around transportation and sidewalks and those kinds of issues. There's legislation that's pending that would increase the amount of physical activity in schools. Legislation that might make it easier to for school facilities to be open to the community. One example, though, that some states have begun to address is soda tax. We know that sweetened and artificially sweetened beverages are a part of obesity issues, as are salty snacks that we all like way too much. But some states, 29 states, have a tax on sodas, and 21 states have a tax on chips and pretzels, those kinds of things. This is above and beyond either their regular sales tax or if they have no sales tax on food, then it's a tax on those specific things. Those things are a long time coming, but they are the kind of incentives that really focus people on healthier eating.
With smoking, that was a long time coming as well, and there's probably still some work to be done there, would you say, despite the legislation?
The tobacco tax in Tennessee is still less than half the national average. Only 11 states have a lower tax on tobacco, and yet it's very clear that that when we increase the tobacco tax, we substantially reduce smoking, particularly among young people. People who are already hooked are not going to be able to give it up, unfortunately, as easily. And about 90% of all smokers start before they're 19 years old. So if we have higher tobacco taxes and we reduce the instance of smoking in the first place, we're going to have substantial impact on long-term health. It's one of the strongest preventive things we can do because smoking is linked to the 4 leading causes of death, to heart disease, cancer, stroke, and respiratory factors. So it's clearly something that as a community we've made a lot of strides and we need to keep focusing on that.
Now, as we move to a close, I would like to talk a little bit about how we help people feel more empowered in this process. What are some things that individuals can do?
I think I would always encourage parents to speak up and ask questions. So, for instance, if you look at your child's school cafeteria and look at what's offered, to say, what are the healthy options that are offered at our school? Are there healthier options that are available? what would allow us to have those options in place? And maybe it's that a parent needs to talk to their school board or to a state legislator. But asking those questions, the same thing with healthcare. What could we do to make our family healthier? Sometimes we in the medical community don't encourage that, and we've got our hand on the door like we're ready to walk out, and we don't have time to wait and answer your question. And I think parents should feel comfortable saying, I didn't quite understand that, or let me say this back to you so that I can make sure I understood it.
Anything you want to add, Ms. Harrell?
I think there are two things that are important. One is seeing your child's pediatrician, and certainly as an adult, your primary care physician, as a partner in your health care, and actively engaging in conversations when you have an opportunity for the well child visit, and teaching your child to also begin to discuss and ask questions. The second thing is recognizing that health is a significant component of the various systems in which you work and live and play and learn, and that it's not something that's just separate from all of that, so that if you're understanding how to integrate that, I think you'll have a better outcome overall, and it'll be more habitual over time.
Dr. Vehec, anything you want to add about individual responsibility here?
I think it's easy to get overwhelmed. I think it's easy for families to come in and feel like, we've got to lose weight, I've got to quit smoking, and so there's so many things on people's plates that I would encourage folks to pick 2 or 3 things to start with. And okay, this is my first priority. Let's work at this one, and then let's work at the next one. That the kids didn't get all of these problems within 2 weeks, and they're not going to be fixed in 2 weeks. And so if we pick one priority and work at that, then it doesn't seem quite so overwhelming.
Linda, how do we get policy to help us implement some of these things? What is it going to take to move to that next step?
I think it takes increased awareness and involvement, people talking to their policymakers, whether they're the school board members or elected officials, city council or state legislators, about the importance of having safe, walkable communities where people can engage in activity and have access to adequate and healthy food. It really takes the community working together. It's the integrated work, it's the partnerships with the medical community, it's all working together, parents and children and other significant people in the community to make it happen. I think we've seen positive results out of things like the coordinated school health. I mentioned the reduction in obesity earlier, and it was talked about in the program. That's so very important, but what we also see is when children are active in school, they not only have reductions in obesity, they tend to have better grades, have higher graduation rates, they're less stressed and really able to be more productive. And it just improves the overall school environment.
I want to thank all of our guests and you for joining the conversation tonight. You can learn more about the children's health crisis in Nashville by going to wnpt.org/children's health. Stay tuned to NPT for continued coverage of this issue. And we want to hear what you think. Write to us at tv8@wnpt.net or call our viewer comment line. Thank you for watching.
Major funding for NPT reports Children's Health Crisis has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carell Jr. Children's Hospital at Vanderbilt, where discovery brings hope, Vanderbilt University School of Medicine, Department of Pediatrics, Baptist Healing Trust, fostering access to compassionate health care in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.